The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
So, Dr. Hamilton, in your opinion, what are some like the early to mid-level to even late-level signs of eyelid aging, and how do we rejuvenate it?
So this is some of the thinnest skin on the entire face, and it's usually one of the earliest places that we see signs of aging. So while patients may have things like rhinoplasty or chin surgery first, this is the first rejuvenating surgery that patients will consider. And what do we see? We see the skin starts to get looser. We see some drooping of the brow, some excess skin hanging here, fat pads kind of getting puffy in this area. Patients will say, I just feel like I look tired and I'm not tired. Why is everyone always asking that? And then we have loss of collagen in the skin itself, and it starts to look crinklier, and you get wrinkles in the corners of the eyes and also underneath the lower lashes themselves. And these are not favorable changes or welcome changes for most people. So those are what we first begin to see. And most commonly, patients start noticing this in their 30s, often mid-30s, because that's about 10 years of slow collagen breakdown or less collagen production relative to how much is broken down. It takes about 10 years to see that. So very common early
Yes.
area of
So
concern.
one of the things, of course, that we all know about is Botox or equivalent for crow's feet. One of the newer things that we know about as well is HA filler, some type of filler for the lower eyelid for mild bags, as well as occasionally PRP or PRF, which helps rejuvenate the skin. So we do know that if you're younger or don't have really that much going on with your eyes, then those non-surgical things that are easy to do in the office help. However, once you hit a certain point with loose eyelid skin, as well as significant under eye bags, then you probably need an operation. In terms of surgery, what do you look at for the surgical patient versus the non-surgical patient? Like, when do you make that distinction in your patients?
So when I'm starting to see significant skin excess and bigger bags, if you have a small bag, I agree with you. You can add a little bit of volume below it, and it kind of hides it. Or certainly if people have a hollow, then it's easy to add something to actually address the underlying issue. But once we see truly big bags, adding volume is just going to make it look even worse, or the cheeks get too big and then it looks just odd. So that's patients really ought to consider lower eyelid surgery at that point. And then for the upper eyelids, Botox, if we get a little brow lift going on, that will help because the amount of eyelid skin is intrinsically connected to brow placement. So if we get the brow up a little bit, you can see how it makes my eyelid skin look like there's less there. And once that's not really cutting it, and we've tried laser treatments, which also cinches it up, that's a great time to consider upper eyelid surgery.
Yes, I totally agree with you. And non-surgical things that can tighten skin, including skin cream, lasers, I've used, and I use it with surgery as well. But I do think there's sort of a limit as to how much skin tightness you can really achieve without actually cutting out the skin and removing it and then closing it up.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.